Neha, your mother is in lot of pain from her metastatic cancer.
Yes, I can't see her like this.
Tylenol is not touching her pain at all.
It is time for us to treat her with morphine.
What? Did you just say morphine? For my mom?
Isn't it given to the dying patients only?
Yeah.
And didn't you say that she's not dying at this moment?
You're right, she's not dying right now, but she is in excruciating pain, and that is not responding to the medications on the first step of the analgesic ladder. So, after all, we are dealing with cancer pain.
I understand that, but do we know enough about morphine?
Yes, yes, of course. It's an age old medication. Let me tell you the history of morphine. It's very interesting. Opium, the word well known to the mankind for the last several centuries. Other than wheat, no plant has ruled humanity more robustly than the poppy plant, Papaver somniferum. Opium was brought to India by Alexander the Great and to China by the Arab traders. It was mainly being used for the treatment of dysentery at that time. Morphine was isolated from the resinous gum secreted by the fruits of the poppy plant in 1803 by a German scientist, Friedrich Serturner. He named it after the god of dreams, Morpheus, given its sleep inducing property. The medical profession was ecstatic with joy at that time. Physicians believed that opium had finally been perfected and tamed. They did not have a good medication to treat pain effectively at that time. Acetaminophen was discovered in 1878 but did not come to market until 1950. Aspirin was discovered in 1899 and was marketed in 1915. They just had laudanum in the beginning, a mixture of the tincture of opium, sugar, and alcohol, and later oral and injectable morphine. Their analgesic ladder started and ended with morphine. The doctors were happily prescribing morphine for an array of ailments ranging from menstrual cramps to anxiety disorder to fractures to alcoholism. Look at this timeline. It will give you a perspective of the journey of opiates in human society. Morphine was discovered from opium in 1803, as I stated before this, only 25 years after the United States declared her independence. 50 years after morphine was discovered, the hypodermic syringe was invented. The soldiers of the Civil War were treated very well with morphine. Over a period of few years, the medical profession and the American society had developed enormous trust in the powers of morphine. Heroin, which is chemically closely related to morphine, was made from a simple chemical reaction on morphine. Down the road, scientists figured out how to synthesize opioids in a lab. Fentanyl is the newest opioid which is being used therapeutically and unfortunately illicitly as well. The most appalling affair was that of opiates being sold over the counter in early 1900s, indicating that how naive the medical and non-medical communities were at that time. Sears, the departmental store that we visit frequently, which is one of the oldest stores in United States, used to sell a syringe, two needles, and two vials of bare heroin, not bare aspirin, bare heroin, all in a handsome carrying case. No prescription was necessary.
My God, this is unbelievable. Heroin was available at Sears? We just got our lawnmower from Sears.
Yeah. And not only heroin, syringes too.
Yes.
It is funny and scary at the same time. But this doesn't seem likely in a disciplined country like America. We have to follow so many rules and regulations here.
Yes, yes. The legal system at that time was vigilant as well. This slide shows the unfolding of the legal thought process in USA until the mid 20th century. First, over the counter trade was stopped. Then, prices were increased. Then, the penalties became harsher and eventually included death penalty. Then, different bureaus were set up for a close watch. Most importantly, FDA was created in 1906 and it took over the control of drugs in 1938. Citizens were prohibited from growing their favorite plants, which were the poppy plants. They were rampantly growing in their backyards by then. In spite of all these stringent legislations, opioid induced deaths, drug abuse, illicit drug trafficking continued to grow. Finally, in 1970s, a fresh look was taken at this problem. The slate was wiped clean. Drug addiction was realized as a medical issue, a chronic disease rather than a moral failing. Comprehensive Substance Abuse Act was passed. This piece of legislation replaced all previous existing federal drug laws. The schedule of controlled substances based on their abuse potential was created, and DEA, that is Drug Enforcement Administration, was established. This is what we follow now. My DEA certificate gives me permission to prescribe drugs from Schedules 2 to 5, except Schedule 1, because Schedule 1 has non prescription illicit drugs such as heroin and LSD.
Opioid crisis is always in the news. How did that happen?
Many laws and acts were being passed in mid 20th century. But on the socio-political side, the soldiers were returning home after fighting war after war. They became a center of attention. Pain of a returning soldier was not just a narrow clinical question, but evolved into a political issue. During the same time period, the pharma companies did aggressive and immoral marketing of opioids, including oxycodone by the Endopharma in 1950 and OxyContin in 1996 by Purdue. In the arena of medical practice, the pendulum had shifted towards overcompassion and correcting the undertreatment of pain. The concept of pain as the fifth vital sign was introduced in the medical practice as a standard of care, creating a wildfire of unintended consequences. This was tied to the financial incentives for the hospital, leading to increased prescribing of opioids. Finally, 20 years later, in 2016, when opioid crisis was in full force, American Medical Association took action against these initiatives by voting to stop treating pain as the fifth vital sign. We have come a long way since the days of Sears selling heroin, haven't we? By now, the medical community has learned a lot about the goodness of morphine, the dangers of false advertising by the pharma companies, and the presence of the substance use disorder in the society. The number of opioid prescriptions has gone down considerably. The current opioid epidemic, as depicted in this graph, is mainly due to the illicit synthetic drug fentanyl.
What did the watchdogs do? Did they not take any action?
Yes, of course they did. In 2016, all the medical providers in the United States were sent letters with the new CDC guidelines. Listen to these two videos. The first one is by a palliative care pharmacist, and the second one is by a palliative care doctor. Both of them are talking about the CDC guidelines.
We found in 2016 when the CDC released their guidelines on opioid use, they specifically stated that patients that were undergoing cancer treatment or had cancer-related pain were under palliative care or hospice were to be excluded from their guidelines. However, what we found is that the document was so large and that exclusion criteria
Yes.
was only mentioned once, that
Yes.
many of our cancer patients kind of fell under that umbrella, and many of those that had pain related to their neoplasm had their opioids discontinued.
I think the crisis, unfortunately, has made everybody fear opiates to such a degree that people either don't want to learn to use them or just don't want to use them because of the potential legal ramifications of prescribing opiates and somebody misusing them or abusing them. And you can't get somebody to prescribe an opiate for even for cancer patients sometimes.
That's sad.
And yes, and so one of my large worries is, so if I get somebody under well-controlled, they're a palliative care patient, perhaps they're well-controlled on an opiate in our unit, who are we going to send them to continue this treatment once they leave our unit? And thankfully, where I work, we have a palliative care outpatient team, so I can refer to them. So because I know they will manage it. But if they go back to a primary care provider, there may not be anybody to prescribe, which is really, really bad. So now we're having people who were well controlled, but are now going to what I like to call unlicensed pharmacists on the street for their source of opiate, whether it's
Right.
prescription pills, it's fentanyl, it's heroin, it's whatever.
So far, I have told you about the wildfires. Wildfires are scary and will always be there to a certain degree. But it doesn't mean that we should stop using fire altogether for domestic purposes, isn't it? So, how do we prescribe opioids in the United States within legal limits these days and feel reassured about it? Other than having a DEA number and following the schedule of substances, the doctors and the pharmacists now have a wonderful tool named PDMP, that is, Prescription Drug Monitoring Program, that gives us confidence in writing an opioid prescription. We can check if patient has received any prescriptions from another provider within last few months, what medication and how many pills were ordered. This database tells the state government about the prescribing practices of a medical provider as well. So, in a nutshell, lot of precautions are taken before prescribing morphine or like drugs such as oxycodone, hydromorphone, fentanyl, etc. We use the WHO analgesic ladder, screen the patient for substance use disorder, check the PDMP, and most importantly, we follow the patient closely after starting an opioid medication. Treatment of health related suffering and pain, such as cancer pain, won't be adequate without opioids.
Now I understand the difference between morphine as a safe medication versus morphine as a street drug.
Yes, we surely do, and hence, doctors like me have been prescribing opioids comfortably and confidently in spite of this opioid crisis.
Hmm. Doctor, I agree. My mother needs to be treated with morphine.